Hi. So now we are going to do the rest of the inhalation anesthetics. In the last lecture, we covered the nitrous oxide, halothane, ether, and the ones do not use till now, that is xenon, and which have been discontinued, like cyclopropane and trilene. So the ones which are newer as compared to those, and they are quite often used in anesthesia. So these are all the fluorinated compounds, and the name is enflurane, isoflurane, desflurane, sevoflurane. Now, they have certain properties which are important for all of them, and some of them do have those properties, some of them do not have those properties, but when it is difficult to remember what properties they have, so I have actually made a table of the important properties. If you remember that table and see that table for yourself, you will know that which anesthetic has what property. So for the properties to remember, you can remember the mnemonic price. Okay? So the properties have price. P stands for pain relief, which is the analgesia, right? Here. R stands for the effects on the respiratory system, whether they are bronchodilators or respiratory depressants. I, we have two I's, irritant and induction. So whether they are an irritant or whether they cause induction, faster induction basically. Because that's what you want in case you wanted to induce. Then C again too, we have CVS and central nervous system. So on the CVS, we'll see whether they are going to depress the cardiovascular system to what extent, if they are vasodilators and they cause decrease in the BP. Central nervous system effects, we'll see whether they cause seizures or they're increasing the intracranial tension. And the last is E. E stands for epinephrine sensitivity or the sensitivity to catecholamines, whether they increase or they do not increase. So these are the the properties, the price properties of all these anesthetics, and we will go through them one by one, and then we'll see which anesthetic is better in what setting, right? So if you remember the price mnemonic and just remember the table which I'll be providing you right now, it's going to be easy for you to just grasp or have a look at the table and remember it, rather than going through all the properties and getting all confused. Okay, so let's start. So first is enflurane. So let's see if enflurane is a good analgesic agent or not. See, most of these fluorinated compounds, they are not good analgesics. So it is an outright no here. Okay, so enflurane is not a good analgesic. So you will have to combine it with a good analgesic like nitrous oxide, etc. Now, effect on the respiratory system. Yes, you see, normally what happens is, I told you, because they're central nervous system depressants, though they all have a tendency to cause respiratory depression and cardiovascular depression. Now, it depends to what extent they cause that depression. Now, here for enflurane, again, yes, they are respiratory depressants, and yes, they are also bronchodilators. So they'll be good enough for patients of asthma. Irritant, whether they're irritant, so when you give them, agar they cause irritation, laryngospasm, bronchospasm, so then you won't be able to use it as an induction agent, because agar patient ko dero cough ho raha hai, laryngospasm ho raha hai, so when you're starting the anesthesia, the patient won't be able to accept it. So whether enflurane causes irritancy? No, it does not cause it. It is not an irritant, so it's better. It's okay to do this. Now, coming to the induction, whether the induction is fast or slow. So all of them are very fast inducers. So remember, all of them are not good analgesics, but all of them are quite good or fast inducers, because they have a low blood solubility and they're lipid soluble as such, but also they have a very low blood solubility. So fast induction, yes. Now, cardiovascular system decrease in the BP is seen by most of the drugs, okay, except for one I'll coming, but yes, it causes a depression of the CVS, so it will cause a decrease in BP. Vasodilatation, it is not much seen with this. Now, central nervous system is important to see if anything is causing seizures or it is raising the intracranial tension. So obviously you will not use it in patients who have already an epileptic history of epilepsy, or you want to perform some neurosurgery. So wahan pe we will not prefer such a drug. So yes, this causes seizures And yes, this raises the intracranial tension. So for this reason, it is contraindicated in patients of epilepsy, right? So you will not give in patients of epilepsy because it increases the propensity to cause the seizures. Now, sensitivity to, whether it increases the sensitivity of the receptors to epinephrine, yes. So usse kya matlab hota hai? If it increases the epinephrine sensitivity, and it will lead to stimulation of the beta-1 receptor, especially in the heart, causing tachycardias. And so it has one tendency to cause tachycardia. Also, we cannot use in conditions where there's already a high catecholamine levels in the body, like pheochromocytoma, or conditions like thyrotoxicosis. So we will not use them there. So these are the basic features of enflurane. So you remember they are contraindicated in epilepsy. Central nervous system mein they are not very effective, not good. Coming to the next, which is isoflurane. Some people also call it as a near ideal anesthetic. Let's see why do they call it a near ideal anesthetic. Ye to I told you, none of these agents, they have analgesic effect. Here we can write no, and yes, because they are cardiac depressant, you can write this one. So you guys, and I told you all of them are very fast inducers, so ye bhi yes hai. Then almost all of them are respiratory depressants. So you should know that they're respiratory depressants, cardiac depressants, and they cause bronchodilation. Yes, it also causes bronchodilation. Again, very good for patients with asthma. And irritant, yes, this is one issue with this. It is an irritant drug, so it cannot again be used for induction. जो irritant नहीं है उसको induction use कर सकते हैं, but जो irritant है उसको हम नहीं use कर सकते for induction. Vasodilatory, property is very, very high. Yes. ठीक है? So because it causes especially the coronary vasodilatation, so it causes a phenomena of coronary steal. ठीक है? Coronary steal phenomena cause करता है. So it will take away the blood supply from one area and go give it to the other area. So that's a coronary steal phenomena. Whether they cause seizures or increase in the intracranial tension, no. So they are good for neurosurgery. And whether they sensitize to the catecholamines, no. So only drug out of these which sensitizes to the catecholamines is enflurane. ये भी नहीं करती है और ये भी नहीं करती. So remember, this is the only drug, enflurane. ठीक है? So it's a isoflurane is very good for asthmatics. It is very good for let's say the in neurosurgeries, and it obviously has a fast induction, but analgesia नहीं है. But problem is induction के लिए we cannot use it. Why? Because it is an irritant. So we can't use to induce. Can be used for maintenance, but not for induction. Next is desflurane. Now, actually, analgesic effect isme bhi it is not much, but if you compare, it is better than others, but not sufficient. So it is better than others, but not sufficient, right? So out of all of these, which is the best analgesic, which has some amount of analgesic effect, that is desflurane. Then coming to depression and bronchodilation, yes, again, it's a yes. Irritant, whether it is an irritant or not, yes, again, it's an irritant. So when something is an irritant, so we cannot use it for induction. Though the speed is fast, but still you cannot use for induction because of the irritancy effect. Then coronary steal, again it causes, just like isoflurane, it has a tendency to cause coronary steal phenomena. And again, it has no effect on seizure ICT. Again, it is good for surgery, neurosurgery. So most of the features, it is almost quite similar to isoflurane. That's the important thing here. And the only difference is it is slightly, has a better analgesic effect, but zyadatar it has features all resembling the isoflurane. Now, sevoflurane, again, it is not an analgesic. There is no bronchodilation at all. So, yes, respiratory depression, but no bronchodilation. So this is one of the drugs, again another drug which is not an irritant, so it is quite good for induction. And this is preferred in children. It's a very smooth, pleasant smelling and all that, and no irritancy, so it is preferred in children. It is a very, very fast inducing agent. So within 2 to 3 minutes, it can cause induction. Cardiovascular system, or where it decreases the BP, actually there is no problem with it as such, right? So it is also preferred in cardiac surgeries. So preferred in patients who have the myocardial infarction, that kind of thing. And whether it causes seizures, no, but it can increase the ICT. So it is not a very good drug. It doesn't cause seizures, so you can use in epilepsy, but it can raise the intracranial tension. So these are the salient features of all of them. So isme se, again I am telling you that remember the price, the mnemonic, you remember the price mnemonic, and then you start visualizing this particular table and memorize it. So enflurane, out of them, you see, so all of them are poor analgesics. All of them will almost cause respiratory depression. All of them will almost, they are fast inducers. And all of them are almost, they are causing decrease in the BP, except for sevoflurane. So seizure causing tendency is only seen with, if you see, with the enflurane. So you remember the exceptions, it's then it becomes pretty easy. Bronchodilation is seen with all. So remember, jo nahi karta, that is sevoflurane. Rest all do. Bronchodilation. Irritant, it is not an irritant. Actually, you can use the sevoflurane or the enflurane. They are not irritants. Then vasodilator, coronary steel is important. So remember, coronary steel with isoflurane as well as with desflurane. This is another important thing to know. So these are the tendencies, and you remember the catecholamine sensitivity is increased only by enflurane. So remember the exceptions, which are less to remember, and the rest all are the same. That is easy for you to remember. So this is for the rest of the inhalational anesthetic.